The syringe in Sandra Taylor's hand as she ran through the hospital corridor was little Emily's last hope for survival. But no one knew what she had experienced in Afghanistan 12 years ago. 33-year-old Sandra Taylor worked the night shift in the intensive care unit at Seattle Children's Hospital. Known for her quiet, calm demeanor, Sandra was called the ghost nurse among her colleagues. She always did her job perfectly, didn't talk much, and kept to herself. Sandra's story actually began in a very different place. Born in a small town, she was her family's only daughter. Her father was a retired firefighter, her mother a school nurse. When Sandra was little, visiting her mother's workplace and seeing the light in her eyes as she helped injured children, she never forgot that moment. From that day on, she decided to become a nurse. But life had different plans for her. When she started university at 18, due to financial difficulties, she had to accept a military scholarship. She completed her nursing education at the military academy and was sent to Afghanistan immediately after graduation. That night, as always, she was silently keeping watch over her patients. As she checked the files in her hands, that familiar restlessness began again. In the depths of the night, memories in her mind came alive. Every footstep in the corridor reminded her of those nights at the Kandahar base, body bags being transported to morgues, helicopters constantly coming and going, and those never-ending emergency calls. But what Sandra was hiding in her past had prepared her for what she would face tonight. 2012, Afghanistan. Sandra was then a 21-year-old young military nurse. She was serving at the base hospital in Kandahar, days filled with wounded soldiers after bombing attacks, sleepless nights. But none of them had affected her as much. When Sandra remembered those days, an eerie coldness still filled her. The base hospital was constantly in chaos. Every day, dozens of wounded soldiers came, and Sandra and her team worked desperately to save lives. But the hardest moments were when civilian casualties arrived. That evening, a shift change was about to happen. As Sandra was checking the last patient of the day, helicopter sounds started coming from outside. The emergency alarm had sounded. 2 minutes later, the doors opened and a family was carried in. One day, a civilian Afghan family was brought to the base. A little girl, her sister, and their mother. The girl was only 8 years old and severely injured, but these weren't just physical wounds. The child was in shock, not speaking, her eyes staring into emptiness. Amina, that was the child's name. Little Amina's mother was constantly saying something in Pashto. The translator said the mother was saying, "Save my daughter, please save my daughter." Sandra would never forget that moment. A mother's desperation was a universal language. Sandra that night had risked her own life to save that child's life. Ignoring standard protocols, she had trusted her own instincts. The child's symptoms showed an unusual condition. No doctor could make a diagnosis, but Sandra had noticed something different in Amina. She could never forget that moment, the fear in the child's eyes, the mother's desperation. And the decision she made that night changed her forever. She had saved Amina, but the price was heavy. Her commanders had sent her to a disciplinary board for violating protocol. This is exactly where Sandra's life changed. And now, 12 years later, she would face the same situation again. Midnight 2:30. The emergency room doors opened, and little Emily Rodriguez was brought to the hospital. The 7-year-old girl had lost consciousness, and her condition was critical. Her mother was crying desperately. Her father was pacing the walls in panic. Emily's father, Miguel Rodriguez, was a construction worker. Her mother, Carmen, worked for a cleaning company. The family's financial situation wasn't good at all. They didn't even have health insurance. But at that moment, money had no importance. The only important thing was little Emily's life. Carmen Rodriguez was pacing the corridor. Mi niña, she kept repeating. Miguel was leaning against the wall, his head in his hands. It was the first time they had seen their daughter this sick. Emily's symptoms were very unusual. She had woken up normally in the morning, had breakfast, and was getting ready to go to school. But around noon, the school nurse had called Carmen, saying Emily felt nauseous and had a fever. In the evening hours, the situation had gotten worse. Emily had vomited, then lost consciousness. The family's rush to the emergency room was the first step that saved her life. When Sandra took Emily's file, her heart raced. The child's symptoms felt so familiar, just like that little girl in Afghanistan. The same symptom pattern, the same type of consciousness loss, the same mysterious findings. The doctors couldn't make a diagnosis. Test results were contradictory. Emily's blood values were in normal ranges, but her neurological examination was concerning. MR results didn't show anything clear. Time was passing, Emily's condition was getting worse. Sandra stood quietly in the corner, observing. The voice inside her was telling her something. That voice was the same one she had heard when seeing Amina 12 years ago. You haven't seen the biggest surprise yet. What Sandra noticed would shock everyone. As Sandra examined Emily, she remembered that night in Afghanistan. Little Amina had the same symptoms. Back then, there was a detail that no one else noticed. The strange fluctuation in the child's body temperature, the change in her breathing pattern. That night in Kandahar, Sandra had waited for hours by Amina's bedside, observing the child. The doctors were applying standard treatment, but Sandra had noticed something different. Amina's pulse would slow down at certain intervals, then speed up. The change in her pupils was also very characteristic. Sandra remembered that night step by step. Amina's mother had said she had given the child a special tea prepared by her grandmother that morning. A herbal mixture prepared traditionally in the family, believed to be good for illnesses. But Sandra had thought this tea might actually cause poisoning. Back then, no one had listened to her. "You're just a nurse," they had said. "Doctors know better." But Sandra hadn't given up. She had secretly done research, learned about poisonous plants that grew in that region. Sandra that night had done something not written in textbooks. She had acted with her own experience, her intuition. She had prepared a special antidote for Amina, taken the risk and administered it. And the miracle had happened. The child was saved. Now, looking at Emily, she saw the same signs. The strange rhythm in her pulse, the change in her skin color, the abnormality in her pupils. But would she have the courage this time? What she had done 12 years ago was against the rules. Her commanders had reprimanded her, written reports. "You violated protocol. You applied treatment without consulting another doctor. This is unacceptable," they had said. But the child had survived. Sandra had decided to leave the military from that day on. The post-military period had been very difficult for Sandra. She had trouble adapting to civilian life, couldn't sleep at night, constantly had nightmares. PTSD symptoms had affected her for months. Only with therapy and her family's support had she slowly been able to recover. The decision Sandra would make would change everything. 3:15 a.m. Emily's heart rhythm began to become irregular. The doctors were trying their last resort, but getting no results. The lines on the EKG were becoming increasingly worrying. Emily's vital signs were rapidly deteriorating. Dr. Martinez was an experienced pediatrician with 15 years of hospital experience. He had seen thousands of cases throughout his career, but Emily's had puzzled him. All test results had come back normal, but the child's condition was inexplicably deteriorating. "We must be missing something," Dr. Martinez murmured. "This symptom combination doesn't match any classic disease pattern." Sandra approached the head nurse. Lisa Thompson was a highly respected figure in the hospital with 20 years of experience. But she was also very attached to rules, accepting no protocol violations. "Tell Dr. Martinez that the child might have a rare metabolic disorder," Sandra said quietly but determinedly. "Sandra, you're a nurse. You can't make diagnoses," the head nurse said in a stern tone. "Dr. Martinez is already doing his best. You just do your job." But Sandra didn't give up. She had seen this condition before, and staying silent could mean Emily's death. Despite the head nurse's warning, she approached Emily's mother. Carmen Rodriguez was sitting collapsed in her plastic chair. Her eyes were swollen with dried tear marks on her cheeks. The woman was holding her daughter's hand in tears, murmuring prayers in Spanish. "Ma'am, has your daughter eaten anything different recently?" An unknown plant, a different food. Sandra knew a few words in Spanish, but not enough for detailed conversation. Maria, a translator working at the hospital, was called. Sandra repeated her questions. The mother looked puzzled. She thought for a moment, then suddenly stood up. See, she shouted. Yes, her grandmother had given her a special tea brought from the homeland, Abuela's special tea, but the doctor didn't say this was important. Sandra's heart raced, exactly as she had suspected. The Amina case from 12 years ago was repeating itself exactly. You won't believe this. Sandra's guess was completely right. Sandra quickly found Dr. Martinez. Doctor, the child might have plant poisoning, especially a rare condition caused by traditional herbal teas. Sandra, calm down. This isn't your area. I had seen the same case in Afghanistan. The symptoms are exactly the same. Please listen to me. Dr. Martinez was impressed by Sandra's determination. Okay, tell me. Sandra began telling about that night, what they had seen in Amina 12 years ago, the treatment they had applied. She remembered every detail. If I'm right, standard detoxification protocol won't work. A special antidote is needed, and we need to act very quickly. Dr. Martinez listened to Sandra's recommendations. A special antidote was urgently prepared, but the risk was great. If Sandra was wrong, Emily's condition could get even worse. Sandra, are you sure? This girl's life is in your hands, the doctor said seriously. Sandra looked at Emily. The little girl's pale face reminded her of Amina. She knew the decision she had made that night in Afghanistan was right. Now she had to act with the same determination. I'm sure, doctor. I'd bet my life on it. The antidote was prepared. Sandra sat next to Emily. She held the little girl's hand. Don't worry, beautiful. You're going to get better, she whispered. The injection was given. Now there was nothing to do but wait. Everyone was holding their breath. The next 30 seconds would determine whether Emily would live or die. 10 minutes passed. Emily's pulse began to regulate. 15 minutes. Her breathing was normalizing. 20 minutes. She opened her eyes. Mama, the little girl whispered. The hospital corridor suddenly came to life. Emily's mother hugged her daughter, crying. Mi niña hermosa, she repeated. Tears flowed from her father's eyes. Miguel Rodriguez was shedding tears of joy for the first time in his life. Dr. Martinez looked at Sandra with admiration. Sandra, you saved this child's life. How did you know? It would have taken me hours, maybe days to make this diagnosis. You figured it out in 30 minutes. Sandra smiled. For the first time in a long time, a genuine smile. Sometimes the past saves the future, doctor. What I learned in Afghanistan came in handy today. Emily's recovery process was amazing. After the antidote began to take effect, the child's body systems returned to normal. The next morning, Emily was fully awake and able to talk. Who is this angel lady? Emily asked, pointing at Sandra. Carmen Rodriguez took Sandra's hands. Esta señora salvó tu vida, mi amor. This lady saved your life. Emily looked at Sandra with her big brown eyes. Thank you, Angel Auntie. You're really an angel. Sandra bent down to Emily. You're a very strong girl, Emily. Beautiful things await you in this life. Dr. Martinez wanted to talk to Sandra privately. Sandra, what you did tonight was extraordinary. You're not just a nurse, you're a health professional with incredibly developed intuition. I want to report this case to the medical journal. Your name should be mentioned. Emily fully recovered. After being kept under observation in the hospital for 3 days, she was discharged with her family. When leaving, she hugged Sandra and gave her a small drawing. In the drawing, Sandra and Emily were holding hands, both with angel wings above them. But the most shocking thing was this. Sandra's story wasn't ending here. The Emily case changed Sandra's life. She was no longer just the ghost nurse, but was now called the miracle nurse. Everyone in the hospital was talking about how Sandra had saved that night. A week later, Dr. Martinez called Sandra to his office. Sandra, I want to establish a new unit in the hospital, rare diseases and emergency unit. Would you manage this unit? Sandra was surprised. Doctor, I'm just a nurse. No, Sandra, you're much more than that. I researched the Emily case. Your diagnosis was 100% correct. I'd read about such rare plant poisoning cases in literature, but hadn't seen them in practice. You're both knowledgeable and have very developed intuition, Sandra thought. For 12 years, she had tried to escape from her past. She had wanted to forget what she experienced that night in Afghanistan, had lived a quiet life. But now she understood that her past was not a burden, but a gift. "I accept, doctor." A few months later, the Rare Diseases Unit established under Sandra's leadership became operational. Sandra was no longer just a nurse, but also a mentor to young nurses. She taught them not only medical knowledge, but also to listen to their intuition, to make brave decisions. Sandra's unit began solving the most difficult cases coming to the hospital. Situations where traditional medicine couldn't find solutions were illuminated thanks to Sandra's holistic approach. Listening to patient history, asking detailed questions, evaluating the smallest clues given by families, these became Sandra's areas of expertise. Dr. Martinez began telling about Sandra's successes at international medical conferences. "Nurse Sandra Taylor is our Sherlock Holmes," he would say. "She can solve the most complex cases." The most important thing Sandra taught was listening to the patient. "Every patient is a story," she would tell young nurses. "If you listen carefully, the disease will tell you about itself." Emily's story had completely changed Sandra's life. Today, Sandra Taylor is one of the most respected nurses at Seattle Children's Hospital. The special unit she established has saved countless children's lives, but most importantly, she is now at peace with her past. In Sandra's office, there are 2 photographs on her desk. In one, Emily is healthy and happy, smiling in her school uniform. In the other is that little girl from Afghanistan, Amina, the first child who changed Sandra's life journey. Establishing contact with Amina had taken years. Due to the chaotic situation in Afghanistan, she couldn't learn what happened for a long time. But with the help of the Red Cross, she was finally able to reach Amina's family. Amina was now 20 years old, studying nursing in Kabul. "Ms. Sandra saved me. I want to save others too," she wrote in her letters. "Emily is now 10 years old and wants to be a nurse when she grows up. I want to be like Aunt Sandra," she always says. Her family never forgot Sandra. Every year on the anniversary of Emily's recovery, they would come to the hospital and thank Sandra. Sandra's unit had solved 47 rare cases in the last 3 years. Each one was a case where standard medical protocols were insufficient, but Sandra's holistic approach was successful. Among these were genetic diseases, rare poisonings, unusual infections. Every morning when Sandra comes to work, she thinks about what happened that night. The biggest lesson the Emily case taught her was that the past is not a burden, but a source of strength. The traumas she experienced in Afghanistan had made her a stronger, more sensitive, and more intuitive healthcare worker. The most important advice she gave to young nurses was, never treat just the symptoms. Treat the person. Every patient has a story, and this story is the most important guide that will direct your treatment. Sandra's story had become legend in the hospital. Newly arrived medical students and nursing candidates learned it as the Sandra Taylor case. But for Sandra, the most important thing wasn't just her successes, but the hope she gave. Every night at the end of her shift, Sandra makes a final check of the pediatric intensive care unit. Walking in those quiet corridors, she sometimes remembers those nights in Afghanistan. But now she feels hope, not fear, because she knows that every difficulty prepares her for the next miracle. On Sandra's desk also sits the picture Emily drew. That picture where both are drawn with angel wings reminds Sandra every day. Sometimes the greatest miracles happen in the most ordinary moments, and real heroes do their duty quietly during night shifts. And Sandra's story doesn't end here, because real heroes' stories never end. They just open new pages. This morning, too, as Sandra was coming to work, a call came from the emergency room. There was a new mysterious case, and Sandra's expertise was needed, because she knew that every new day was a new opportunity for a new miracle.